Mexico has now surpassed 400,000 confirmed cases of the coronavirus. Almost 45,000 people have died as a result, and as the country battles the pandemic, patients in the border city of Tijuana are seeking medical help in California. So CNN's Matt River has more on this story.
Among those waiting outside public hospitals in Tijuana, Mexico, death is a constant companion. Diana Lopez didn't get a chance to say goodbye to her father-in-law before COVID-19 took him. She says, imagine a family member suddenly gets hospitalized and you just never see them again. Tijuana and its state of Baja California are among Mexico's hardest hit regions. For months, healthcare workers have told us about overwhelmed hospitals plagued by a lack of supplies. Roughly 20% of those diagnosed here with COVID have died. This nurse says we were not prepared for the magnitude of what was and is the pandemic.
Tijuana sits just across that border there from the U.S. state of California, and though it's closed to all non-essential travel, if you're legally allowed to be in the U.S., be it as a citizen, permanent resident, or otherwise, you can still cross, and if you want to, seek treatment at a U.S. hospital.
Which is exactly what Dr. Patricia Gonzalez Zuniga did when her husband got the virus. The couple are dual U.S.-Mexico citizens but live in Tijuana, where Dr. Gonzalez Zuniga has worked for decades treating the city's poor. She says the public health system is broken, so when her husband got really sick, going to the U.S. for care was an easy choice.
It's like a decision of a stay and maybe, 50% chance that you will die or just go and get services.
At nearby Scripps Mercy Hospital in Chula Vista, California, we learn her story isn't unique. The hospital has been at or near capacity for months, in part because of patients from across the border. In July alone, it has admitted more than 50 COVID patients who recently came from Mexico. The hospital says the vast majority of patients who've traveled from Mexico test positive.
It does create stress in the system, and we have to deal with it.
Dr. Juan Manuel Tovar says at its peak, 50% of all COVID patients at the hospital had been south of the border, though the number has gone down as new cases in Baja California have slowed. But cases in California have spiked recently, so his fear is if the same happens in Mexico, a tough situation could get even worse. But he says this is the border. Everything is shared: culture, commerce, and COVID care.
This is one region. I have no qualms about seeing patients from Mexico.
Dr. Gonzalez Zuniga, for one, is extremely grateful for that fact. Her husband spent 14 days in a California ICU, nearly intubated several times, but he lived.
What do you think would have happened if he was in a public hospital in Mexico?
He wouldn't be with me now. He will be dead.
She calls herself lucky, and compared to the Lopez family, she is. They couldn't get care in the U.S. Maybe we could have gotten him better care over there, more opportunity. But now, after her father-in-law's death, that is nothing more